Hi everybody, I'm Helena Webb. I am the candidate for state representative in District 100, and we're about to go into get out the vote mode here, but I wanted to take a few moments to address some of the trashy mailers that the GOP has been sending out on me. This might look familiar. I'm going to use notes because I have a lot to say and I want to make sure that I communicate really well with you guys and let you know how I'm feeling about those mailers. Most people see those mailers for the trash that they are, but I did want to offer some thoughts to anyone who has questions or who has doubts based on those mailers. I hope you'll listen for a moment and then go check out my website, helenawebformo.com, and you can see how much of a centrist I really am. But my thoughts about Missouri healthcare, believe it or not, are guided quite a bit by the findings of the GOP McKinsey report, which was commissioned by former Governor Greitens. And that report essentially says that by offering more preventative and continuous care to those with less, we will save money for the state, for those of us who pay for our own insurance by bringing down costs, and we'll create better outcomes and a more healthy workforce. My thoughts are also guided by Medicaid expansion, which you, the people of Missouri, voted for. I didn't campaign on Medicaid expansion early on in the election because I wanted to see how my district voted. Unlike my opponent, Derek Grier, I respect the votes of people. I don't like when politicians try to overturn our votes or gut the things we vote for. And I waited to see how you would vote, and indeed, District 100 voted overwhelmingly for Medicaid expansion. So these mailers, they say a lot of ridiculous things about me. The most interesting claim that they make is that my dangerous ideas will close 37 hospitals. The truth is that Republican policies have already forced many rural hospitals to close, at least 4 as of 2 years ago. The truth is they have cut reimbursements to nursing homes, so it is harder and harder for them to provide care. They have made line item budget cuts that have reduced hospice care. I mean, can you imagine being in hospice and having some of your care withdrawn or not being able to receive it at all? Republicans running for office, and I'm talking about politicians, I'm not talking about people, I'm talking about politicians. If they're running on this kind of fraud, they should be honest. They should just say, we believe in small government. We do not want to pay for health care. We don't want to pay for it for anybody. Because that is why they don't want to pay for it. It's not because it's going to cost money. Republicans under Governor Parson ignored their own report because it didn't say what they wanted it to say. They ignored their own experts because they don't want to spend a dime on us. My opponent, Derek Grier, actively campaigned against Medicaid expansion and has actively tried to reduce care to the needy, and he is campaigning as if he has not done those things in his mailers. No one knows how much Medicaid expansion will really save or really cost, but the study they cite on these mailers is a debunked study that is designed for political use, and a much more reputable organization to talk about these issues, I think, is Washington University. They backed Medicaid expansion. Now, unofficially, a lot of people feel that Washington University is a fairly conservative organization, and they came out strong for Medicaid expansion because they know that in the current environment, with all of the current free market mechanisms we have, the only way to reduce costs is to actually take care of people who can't pay for their own health insurance, because we pay for it in the end. If somebody goes to a hospital and can't pay their bill, that gets shifted to us in our health care, in our premiums. If somebody has diabetes and does not get medicine, and they become an amputee, and they are then actually disabled, then they qualify for care. It would cost a lot less to keep a person healthy and let them have a more a life where they have more options. Instead, we take that away. If a person has a heart condition and they have children, or they have a chronic disease that could be managed and they don't get that management and they pass away, their children end up in foster care. Everything costs money. You do not get out of the fact that people need to eat, they need to be healthy so that they can work, they need to take care of their children, they need to feed their children. And it's really hard to do that when you're sick. Washington University said that Medicaid expansion would deliver health care to 230,000 hardworking Missourians across the state. It would create 16,000 new jobs with an average hourly wage of at least $15 an hour. It would bring $1 billion of tax dollars back to our state. This is another thing. You know, we've been sending tax dollars to DC, and we're not getting it all back. We could get a lot more of it back. It would protect rural hospitals. They said that 27 were now in danger of closing without Medicaid expansion. If I'm elected, I will fight to implement this expansion efficiently, to reduce costs, improve care, and create jobs. It's the right thing to do. So in the end, my quote-unquote dangerous plan is your plan. You voted for it, the people of Missouri, and I respect your vote. Please vote for me, Helena Webb, for state representative in District 100 on November 3rd. And no matter what, get out there and vote. Have a great night.